I would hate that.
Do that a lot.
I am totally spontaneous. I can't follow rules.
Very, very difficult. Can you reach or move over here? I'll make room for you. There's something. Is able to. Oh, good. Have your feet.
Right, I think someone has the speaker volume on their laptop, just make sure that that's off, otherwise we'll get feedback. So obviously stay
Pretty
muted
darn
and make sure the
close, aren't
speaker
we?
is on.
We're close.
You know, I've done a lot of interesting things in my life athletically, but getting a forum to this, well, any one of those.
Acrobat.
Yeah. Right? I mean, the food will hopefully be the big selling, right? When we did this in Plymouth, we had a great lunch. Were any of you guys there? Bobby, you were there, weren't you? When we did a meeting in Plymouth?
A while ago.
It was my welcome to Shawship, actually.
The previous administration.
I thought we had food at every meeting.
There was a special, we looked at that, there was a special host that paid for that, for you.
Really?
Yeah, it didn't come from the funding. or
Was it the
whatever,
Plymouth
was
people that
Yeah,
maybe
they
did?
came in and, yeah.
So if anybody wants to host a meeting and provide food, you're. I'm ready to start whenever you are. Should we wait a little longer or no? This is a full agenda. And we're gonna learn all sorts of smart things that are gonna save all of us. We do?
Well, we have to see
Oh, wait a
about
minute,
what's
online.
online, but I think we can get going if that's all right, and when we get to roll call. we will-
Well, no, we're close.
Sadie?
It's with-
This is really sad that it's a great moment in my life, but it is. This is a perpetual problem in other committees too.
You've got fabulous members.
We really do. You might could keep this up or one right here.
Two more spaces up here.
Like church, we should have an usher. So still, wait, so.
Are we okay with getting started?
Fine. Good morning and welcome. I have to say this to start apparently. Welcome to the New Hampshire State Health Assessment and State Health Information Plan Advisory Council meeting. And if we have another meeting, we can make that a little shorter. Anyways, it's good to see everybody here today. I think we're gonna finally have a quorum. We will get to that in a second. So next slide, right? Yeah. So, these are just logistics for the meeting,
Make sure the speaker volume is on.
She's working on it. The pressure.
So one of the things that's really important, especially if you're here, it doesn't matter. If you're not here, if you're online, you need to be video and audio when you're speaking. And we will also want your name and affiliation displayed on your Zoom screen. Everybody here, please log in. We already talked about the audio, camera we already talked about. When you want to raise your hand, when we actually do the presentations, people that are here, you can actually raise your hand physically to speak, but on your computers, you can use your icon, use the chat function to make comments. And I guess state who you are before you speak. And everything will be mailed, as has been the case in the past. All right, procedural. We're not going to do the roll call yet, right? Correct. So Do we have a quorum?
Right after roll call, we'll know.
So we can't do that yet either.
I just don't want to jinx it, but go ahead.
Yeah, I think right now we're just going through the agenda.
Okay, all right. So if we do have a roll call, we'll do something miraculous that's really important for transparency, but we will be able to approve all our minutes. And we'll be able to get them published and posted, which is like really important, which is why quorum's important. And then we have to do a formal vote on the chair and the co-chair. The co-chair is not here.
And it's not available online. It's something really important.
No, I know it is. I
Okay.
know. I like to dump on him because I talk to him on a regular basis. We're gonna spend,
Tell him that, you know, he wasn't there, so we didn't vote on the.
we just elected him chair of every sub. Which involves bringing food.
And he's hosting the next meeting.
Exactly. He would actually say yes to that.
He would, but he'd like us to drive.
He
That's
would
right.
do that. He would do that. We're gonna do 10 minutes of work group updates, so we can find out what's going on. All the minutes were sent to you. And, this is a big deal now. I'm sure that you're all aware of the budget issues that are ongoing. We're gonna just focus on the state, not federal, but it's a big deal and we want to talk about how that affects us all. And then also the specific health impact on public health. And then I have a special announcement and next steps to stay tuned, so nobody should leave early. Anyways, next. All right, so now we do the roll call. All right. So we're gonna do the roll call first, and I'm just gonna go down the list, so just say if you're here. Alexandra Sosnowski.
Yeah.
Yay, and I'm gonna get to know everybody eventually, believe me, it might take 10 years, which means I gotta run for office again, I guess. Elisa Koo, yeah, and Andy Hession. Am I saying your last name right?
Yeah, that's actually.
Good job.
That's the first time.
It's the first time someone's gotten it right on the first.
Yeah.
Work on this at my job. I always like practice names before I see, and then Anne Landry. Anna Thomas. Benjamin Hilliard. Beth Daniels. Bobby Bagley. Christine Brennan. And you guys will let me know if somebody's online, right, when I call you.
Folks online are welcome to chime in if their name gets called, but obviously if we miss you, let us know.
And David Nagel, that's me. David Rochford. Oh. Deidre Daly,
Yes.
yay. Ed, no. Jennifer Johnson. Yay. Sorry, I'd like to cheer. I ran a Boy Scout troop. There's a lot of cheering that need to be done. Joshua Meehan. Justin Romanello.
I believe he's
He should
online.
be online. Justin.
Trying to get to the mute. Sorry about that. I am here in Nashua at my home. Sorry I couldn't make the in person.
Thanks for saying that. If you're not here, just say why you're not here.
And that was my sincere voice too. Just I am
Yeah.
sorry.
That's close.
Kim McNamara,
Here.
Lauren Pearson,
Good morning. I'm here joining from my office in Waterford, Vermont.
ooh,
Sorry to be absent this morning. I am feeling under the weather, so happy to be here, but wish I could be there in person.
I hope you feel better soon. Margaret Pritchard,
Yep, I'm here.
this is exciting. Oh, you have to say why you're not here.
Oh, I'm working in Laconia today.
That's fair. Martha McLeod,
Hi, I'm here in Franconia in my home office and I have to be at another meeting right after this one, so I can't be there.
as long as you don't leave early for the special announcement. Just joking.
Okay.
Mary Reed. Megan Hustler.
Here.
I should get that.
Okay, it's always like, nobody ever says it right.
Shoot, I'm 1 for 2. Melissa Martinez Adorno. Monica O'Clair,
Here.
Yay. Morgan Harris.
Here.
Yay. I have to talk to one of your friends. Phil Sutton.
Right here.
This is amazing. Polly Campion.
Here.
Rebecca Tallman. Ruben Hampton.
Present.
Thanks. Suzanne, Delousher. So I can say it any way I want. Sue Prentice. Is Sue here? No. I'm gonna yell at her. Tori Jennison.
I am here in
Are you-
Dover, New Hampshire. I had a schedule conflict today.
Trish is on.
I'm in for Tricia.
Yay.
And can you tell us your name just so we can write it down?
Yep, it's Maggie Graul, Graul.
Thank you.
Whitney's here.
Here.
Bill Palmer. I'm gonna yell at him too. And then, vacant, is vacant here, vacant. Vacant here. That's gotta be a
So
quorum.
by my count, we have exactly 21 folks present, including 16 in person, so.
All right, now we can celebrate and bag the meeting.
Second.
I know. Both of you. All right, good job, everybody. So we did all that. And then we have to talk about non-voting members, right?
Yeah, I get it just for attendance.
Yeah.
No, voting.
So if you're here, anybody is a non-voting member here?
Scott Foster, HHS.
Jess
So guys,
Williams.
please, can you remind us?
You're a
Guys,
voting
update?
member, you're a
Yeah.
voting member. Everyone who was just called was a voting member.
Yep.
So anyone who wasn't called, it's your turn now, I think.
Yeah.
Jess Williams, New Hampshire Fiscal Policy Institute, just presenting today.
Jess presented.
And then Bronwyn Barnett, HHS.
And then I think that.
Yes. I'm Judith Jones from New Hampshire Alliance for Healthy Aging, and I think I am Martha's alternative. I think we have,
No.
so.
Wait a minute, who you're alternative for?
Martha McLeod?
Martha.
Okay, and I think
Yay.
Martha's on.
Martha is also here, so you two, I don't think get 2 votes, but
We can go to major quorum, that's right.
Practice at every meeting.
Exactly, from the reason I get it.
That's pretty neat.
Thank you.
Anybody else here that's not a voting member? And then,
the 2 of us, right, we're not
Yeah.
facilitators, Palmyra and Richmond.
and then online?
No, you're a voting member.
No, online, is there anybody on?
Fine, there's no one else online.
Okay, all right, awesome. All right, what's next? We did the quorum. Okay, the next is the minutes. How many years of minutes are we talking about?
I don't know, but I've never seen a set that I've objected to.
So if the idea or the goal or the hope, and certainly anybody can say no if you want, but if we could have a motion to accept all the minutes,
All past minutes.
all past minutes.
So moved.
So moved.
Second.
Second, great. We need a
Everybody?
roll call vote, right?
I don't think so. For
No,
this?
I think
No, because we have people that aren't here.
Oh,
The online is
okay.
contributing to our quorum,
All
right?
right,
So.
go ahead.
So we have to go through the list again.
Only for the people that are here. Well, all right.
Yeah, because if everybody was here, my understanding is we could just do a
Just do
voice
that.
vote, but because we're not, we can't.
Are you requesting David a roll call,
What's
or
that?
is it required? Are you requesting one or is it required?
Required.
Okay.
Yeah, I've been through this enough times now. All right, you ready? Yay or nay? Alexandra
Yeah.
and then Ali,
Yeah.
do you mind if I just say first name? Okay. Andy,
Yeah.
Hessian, I want to say it right twice. Bobby,
Yes.
David, yes. Deidre,
Yes.
Jennifer, Justin,
Yes.
Kim McNamara.
Yes.
I might say your last name if there could be more than one of you. Lauren,
Yes.
Margaret, Richard, Martha McLeod,
Yes.
Megan Hustler.
Yeah.
Monica,
Yes.
Morgan,
Yes.
Phil?
Votes yes.
You were the one I was worried about. Polly,
Yes.
Ruben,
Yes.
Tricia,
Yes.
Whitney.
Yes.
Did I miss anybody?
Tori?
Oh, sorry. Tori? You're right, I didn't check you. Unanimous? This is really fun. All right, now we have to vote on the chair and the co-chair. I have no idea how we should do this. So I'm the chair and it's the co-chair.
So you could ask for a motion to elect a chair or continue the or not continue, or to elect a chair and then nominate. Or you could just say a motion to nominate Dave as the chair.
I feel funny doing that, but
No, all right, so please, someone else do it.
There's a motion on the floor made by Margaret Pritchard for the chair to be David. And I think we can do it in one. I think we can do a chair and a co-chair at the same time. But if you tell me not to, I'll wait and shut
if
my
you
mouth.
make that motion, we can do that.
And I think if we say we're doing it by acclamation, we won't even have to have any ballots, it would be clear,
Okay.
blah, blah, blah. Okay, good.
Okay, so I'll repeat the motion. It is to nominate David as the chair and Ed as the co-chair. And I would say their last names, but I will kill them. So you will just write them in the minutes. So
If you say Nagel in German, you get extra points.
no specken die Deutsch, so I can.
And Shenshalla. So, all right, we need to do a voice vote again. Do we have the motion was seconded?
Yes.
Okay.
Second by Robert.
Ruben second. Yes, since you originally moved it at the same time.
All right, you ready? I feel funny doing this too, but yes, I need to, right? Because I'm the acting chair.
Yeah.
All right. Alexandra,
Yes.
Ali,
Yes.
Andy,
Yes.
Bobby,
Yes.
David Epstein, Deidre,
Yes.
Jennifer,
Yes.
Yes.
Justin, Kim,
Yes.
Lauren,
Yes.
Margaret,
Yes.
Martha,
Yes.
Megan,
Yes.
Monica,
Yes.
Morgan,
Yes.
Phil,
Yes.
Polly,
Yes.
Ruben,
Yes.
Tori,
Yes.
Tricia,
Yes.
and Whitney.
Yes.
And I got everybody right that time.
Yes. Yes. So another unanimous vote.
Accepting this award for Ed Chanchalla, wherever that is. So just, I feel obligated to say the only election I ever won in my entire life besides being, my election to the State House was brewmaster in my fraternity. So this is it's probably a big step up. Although that was a pretty entertaining job. All right, we're ready for work group updates. Let's see, we're gonna start with the measurement committee, and Lauren, you're on.
Great, thank you so much. Well, I'm Lauren Pearson, the Executive Director for the North Country Health Consortium, and I have the privilege of serving on the measurement work group. So we have been charged with selecting, refining, and reporting data measures to support the monitoring and improvement across the SHA-SHIP framework. This work is really aligned with the state legislation and focuses on improving population health, reducing inequities, and then optimizing our public health system across the state. And there are really 4 key components to the annual report that I wanted to highlight for the larger group. And that is the structure and the content. So measures are grounded in the existing SHIP and enhanced by the work group input. There's also the narrative context to really explain what key data sets are missing or outdated, the interpretations considered, so margins of error, significance of year-over-year changes, excuse me, and the measures that may not be available in the future, such as time-specific snapshots. The second focus area is access to opportunity, housing, health status and outcomes, and then the social connectedness piece. Some of the data challenges in that third component that we've talked about as a group are some of the previously available data sets are now restricted or are no longer updated. And so how do we navigate that? And then also the data granularity limitation. So for example, small counties versus sub-state geographies, things of that nature. And then the differences in measured definitions across sources. So for example, the definition across the New Hampshire housing versus ACS. And then the fourth and last component of that annual report is really the methodological guidance. So we talked about using appendices to balance brevity and the detail across the report. Also recommended cautioning over interpreting year-to-year fluctuations as things change throughout the years. And then suggested blanket disclaimers where available and appropriate, and then the inclusion of key disparity measures and narrative linkages to other SHIP domains. So some of the emerging recommendations that have come out of the group are really focusing on 2 or 3 key insights per domain to really streamline the communication and promote accountability, exploring incorporating alternative or supplemental measures in the future, such as the distance to providers or measures tied to specific populations of focus, while also maintaining the flexibility to highlight measures that are relevant or significant to the policy changes that we're seeing in events. So for example, the Medicaid unwinding and SB 246 are some that we've discussed as a group. There are also cross-cutting issues such as the state and federal policy impacts, legislative tracking, and data integration. And then collectively as a group, we are really focused on incorporating the group's feedback and producing that final report. And then also the future planning and materials that may be shared across the summer, and also reports that will serve as supplemental information to the SHAW and the SHIP. And I would open it up to any other group members if I have missed any of the key pieces that we've discussed over the last few months.
Beautiful. Thank you very much. That is something that always drives me nuts, but measurement is so important. And I like in my life, I can rely on people like you to make the measures I don't want to do. Because that was really great. I really like that.
Thank you.
So we're not doing questions, correct? Or are we?
Anyone
Do
have?
we have 10?
Yeah, did we have a moment? Yeah.
Yeah, if anybody has any questions, that would be. Because I have one. So when I do legislation, one of the things that's really important to me is definition. Because like, for example, in legislation right now, there are 12 different definitions of what a healthcare provider is, which I don't think is good. I think that they need to be, a little bit simpler than that. Would it be helpful in measurement to some of the definitions you're talking about that are variable to actually define those in statutes, so we can always be talking about the same thing no matter where we are?
I think some of that would depend on data availability, because you could make a definition, but do we have pieces of data that also adhere to that same definition? And we don't, it might actually make things much more difficult, because we'd have to find something that went up to that, or if not, try to triangulate it.
Yeah, we just went through that with harm reduction, so I know exactly what you're saying. So we should just leave it as it is.
You have to say what's available and then define what's available versus.
Or
if you define it, be willing to wait if we're going to try to gather that information, or if it's feasible to do so.
Okay.
Okay, another question. Would there be benefit to your point, would there be benefit as the data are being defined and collected to call out sort of a list on the side that identifies definitional differences and where in statute they exist, so that if there's a goal going forward to bring some consistency, it's a good starting point for doing that.
I think that's a great idea. So that would be part of the report. And that is our role, is to make recommendations too in the future. So it can be a moving target, but you guys know way more about this than I do, but that would be a moving target that we can keep on the agenda moving forward. I always love it when people know when I say something. No. Any other questions? Comments?
I would not know.
All right, next, Tori on health status and outcomes.
Great, thank you. I'm Tori Jennison with the New Hampshire Public Health Association, and I'm so sorry that I'm not able to be with you in person this morning. I'm going to give you a quick report on the health status and outcomes work group. You may recall that this group is looking at kind of the measures and the metrics in the SHASHIP, and from a kind of to what end perspective, not necessarily a data integrity or reliability or validity perspective as the measurement group did, but what do we want to be measuring? What do we understand as important to understanding the health status and outcomes for folks who work, live, and play in New Hampshire? And the Brandeis team will be doing a report on this committee's work that will summarize kind of our recommendations to date with the somewhat abrupt shift of resources for this work. I'll talk to you about where we ended up. So there's certainly, we had a couple big observations that there are changes in what data was available when the SHASHIP was crafted to what data is available now, both in its literal availability, like it's not on the web in the traditional places that it used to be anymore, CDC, NIH, some of our AHRQ data sources, they just aren't published. In addition, some of those data sources are no longer being collected, so they won't exist anywhere, even if there is a change in administration policy as to what's available and how we access it. So those were two of our really significant concerns when we make recommendations about what we want to focus on for health status and outcomes moving forward, is what's available to be able to measure. Well, secondary data isn't ideal. It's going to have to become a little bit more ideal than we've thought of it before. So that kind of national trend is also a concern at the state level. There are some areas of health status and outcomes that we really want to look at, but the data sources don't exist. It's not news to anyone. New Hampshire's data environment has very much resembled the New Englander farmhouse, where every generation a new wing gets tacked on to meet the needs of the new residents. New Hampshire's data system is similar to many states, but it's no different. Every time there's a new grant or a new policy priority, data gets collected. The collection and integration of that data with the other data that's available isn't always as smooth and as connected as we'd like it to be. So that leads us to identify some concerns as far as what we're measuring around what will be available in the future, where will it be available in the future, what elements of certain data sets are likely to stay consistent and available, and are there elements that are likely to go away if the entire data set is not kind of removed. So the Brandeis team will be highlighting some of those concerns in their report, the significant themes that we identified to really focus on moving forward around what data is available, how do we measure these outcomes, are maternal health care and maternal health status, and access in terms of what folks have available for care in their region. Are there care deserts? Because we have seen a lot of consolidation, we have seen a lot of shifting of workforce to different parts of the state and away from certain parts of the state. So we are concerned that that shifting as it continues will impact workforce availability, will impact data availability, and will impact the measures that have already been identified in the SHIP as far as what we thought was going to be important to look at in New Hampshire. So I think the big takeaway from our work group is that it's going to be really tough. It'll be a challenge to make recommendations with so many moving pieces. But we really are hopeful that we can come together with a shared voice around the importance of investing in data collection, especially at the state level, given the uncertainty at the federal level, and talking about integration of that data. How do we do a better job of making sure that the data that is available is accessible and collected in a way that gives us guidance and direction. And I am happy to cede the floor to anyone else in that work group that wants to add anything else.
Do we have any questions?
Tori, Kim McNamara from the New Hampshire Health Officers Association. Since we are not certain about how stable government is going to be on any level in the future, have you looked into non-governmental sources that aren't overly influenced by government policies for those data sources?
Yeah. Yep, that's a great question. Thank you. And that is exactly what we're talking about, in that right now, we don't want to create further inequities by creating a more recognizing the market for data. Yes, there are lots of sources out there. There is lots of variability in terms of providers' ability to pay for it. So the short answer is yes. The longer answer is when folks are already reporting, we should be doing our best to make sure that we are getting everything we can from a knowledge perspective out of that reporting that's already happening, because doing more than that adds a burden somewhere, whether it's a cost burden for accessing someone else's repackaging of that data, or a cost burden to collect new, different data. I'm hopeful it doesn't come to that, Kim, for general data access. So it's a thing. Are you thinking of a specific source aside from New Hampshire Wisdom and some of the more traditional open data sources?
Well, we have the same concerns about the stability and availability of any information through any government sources.
Yeah.
And so I'm just thinking that we might need to tap into other non-traditional sources that have accurate and consistent data, private companies that perform some functions. There are groups, I know that in Vermont, there was an agricultural medicine group that did a lot of rural health issues, training and that sort of thing. And although I'm sure they are grant funded to a degree, they seemed more independent. I don't know if we have anything equivalent in New Hampshire. So I'm just thinking outside of the box for that.
Yeah. We likely will need some sort of collaboration that doesn't exist right now. You may remember when the Medicaid 1115 waiver first came around for DSRIP, there was a kind of a hope that New Hampshire could animate a data aggregator that would do a lot of what you're talking about. That didn't come to pass for lots of reasons. Some of them were legislative constraints, and some of them were cultural with providers, and some of them were contractual. So as technology continues to evolve, we've had a decade of court feedback on what's shareable and where the lane lines are for data exchange. I think I'm hopeful that we'll be able to protect publicly available data and not have to get into this space of who can afford to access what, because that is not a healthy place to be.
Thank you.
I have two comments. One, I really like the discussion around, so I'm going to present later on how the division is using our block grant funding, and part of that goes to data collection, which is fairly costly, and so I love hearing about thinking what data already exists that we might want to like tap into and just get better at collecting. And then related to that, I'm just thinking future for this group. I'm struck by there were a number of bills this session around the legislature wanting additional data. So for example, there was an ALS registry bill that was heard and had a really, I think, almost $1 million price tag costed for it. There was actually risk of us losing our vital data for birth in New Hampshire. So again, like we wouldn't even be able to tell how many babies we have. And then there was an abortion statistics bill that was heard where they're wanting to collect more data in New Hampshire. And so, you know, if this group has input or thoughts on data that is valuable to the SHA and the SHIP, maybe in the future sessions, we can be kind of coalescing around those, because it's just it's funny, even though we're sort of live free and die in privacy, like, you know, focus, there are a ton of bills trying to get more data in New Hampshire. So it'd be great to have priorities.
Since you keep looking at me, I was involved in 2 of those bills, but one of the lessons that I've learned in politics now is the cost of data collection. And we saw the sticker shock on the ALS registry almost fell over. I mean, we're talking like a small number of patients and we're talking almost $1 million.
Yeah.
And that's the one thing that gets certain legislators freaked out. And there's a practicality to that too.
And I had a really good question this session from somebody saying, well, if we do this one, like for the abortion statistics or for ALS, can that system then be used for all these other health outcomes? And unfortunately, the way things have been proposed, the answer is always no. But again, there could be some sort of approach, like I know the Tori's point about, like, I think we've had legislation around a health information exchange before. So it would be good to think of a system that is going to more broadly meet the needs than just a one-off. So.
And that could be a recommendation to come from here.
Yeah.
Right?
Yeah.
Do I have time for a question?
One question,
I
Dave.
mean, and I'm putting my provider hat as a doctor on, but like, I'm gonna quote Charles Woodridge, who showed up at Lyndon Johnson's office in the 1960s and informed him that we needed to increase the school lunches to the poverty-stricken areas that were served by Catholic schools in Denver. And that became a nationwide program. And Lyndon Johnson's response to him was go back, get the data and come back again. And Father Woodridge was kind of an overbearing gentleman. And he just looked at him, he says, I don't need data to prove what I see every day. And there's a comment made in one of these reports about the value or non-value of anecdotal data that we see every day. And I'm just curious what your thoughts are about how we can use anecdotal data rather than expensive data to solve problems that we already know exist, that aren't rocket science. And I want to know what your thoughts are about that.
You in general, and in this room, you mean?
Yeah.
Well, I think there's a lot of value in that, and I think it gets away from some of the definitions we talked about. You know we have a problem, we can all call it the same thing, but if it doesn't fit that definition of data, then it's not going to be counted. So I think that more thought needs to be given to that. But I think whenever we're trying to solve a local problem, it's anecdotal data that gets us there.
At least gets us started.
Hospitals use a lot of anecdotal data in their community health needs assessment. So we have to go out and talk to people, and that's a lot of what builds up. But we take it very seriously, so we have the other thing.
I think the other thing is we have to balance it, because right now the stories aren't making a dent in some of the perceptions of legislation.
The anecdotal data, I think, can also cut both ways. And that when you're talking about the community needs assessment, the anecdotes that you're talking about, I believe, are sought. They're elicited, which sometimes is called qualitative data. But voluntary stories that are told, one could, with a certain goal in mind, elicit many stories that come out that may or may not reflect sort of the broad, for lack of a better word, truth. accuracy of a given situation. So I'd like the thought of using anecdotal data to get us started and clarify what issue does this raise? What concerns would we want to think about and understand how we clarify that in a more detailed or accurate.
That's so important, Polly, because a lot of anecdotal data can indeed be biased. Because you're getting any willing, which is a lot of the data that was in the ship itself, in the shop, is any willing participant or those who are willing to talk versus folks who are not able to or feel like they cannot tell you their story. And so that bias of anecdotal data, I'm just saying, so I absolutely agree that it needs to, you usually do both. It's usually that mixed methods view, and people use anecdotal data, as you said, to make the story, make the case, have someone do testimony. But it really has to be backed, or else you're developing policy based on the noisy, as opposed to making policy that's really going to make changes for all folks in New Hampshire, which is what you said in your, in your shift.
I think the other value is that I heard a study yesterday morning on the news that 60% of data for cases that go in for medical stuff are not complete. Well,
Yeah.
I mean, it really starts to poke some holes in things.
If I could just add though, if anecdotal data is really what tells you what's working, when the people who are affected mostly by the issue are the ones that say, yes, my life has improved. And if you think about some of our vulnerable populations, particularly persons with intellectual and developmental disabilities, they've been in the same boat wreck for 40 years and get very little progress in making a better quality of life. If you ask those people anecdotally, or those families, what would really make a difference, they'll tell you, and it's usually less expensive than all our figures for budgets and, all the kind of data collection we do. So I think I wouldn't want to discount some of it because of the issues we're concerned with, because that's how we're really going to know when things are okay.
Yeah, Kim, I think you've really nailed the crux of the issue, which is who values what outcomes.
Yes.
So quality of life, we don't pay for quality of life. I mean, we meaning the healthcare payer system, we don't pay for quality of life. We pay for procedures. We pay for maintaining a health status. We pay for maintaining effort in terms of providing services. We don't have a measure or a metric for quality of life. And I think that's why it's super important to say, yes, anecdotal information helps us identify places to look, but it's not a framework to do the looking, because it's not reliable to across populations. It's not generalizable, which is what we're talking about here. While we're identifying populations that we're concerned about, at the state level, it's really tough to generalize from an anecdote or even from a group of anecdotes, because we need to put a price tag on services, and we need to have a conversation about this much investment will get us this outcome. And that is really hard to do with anecdotes, because that measure of what's important, as you identified, is really different for everybody. So there are almost two different conversations. There are, and what systems are responsible? Is the city more responsible for addressing quality of life issues than the healthcare payer? Maybe. Than the healthcare provider? There are things we can do at the population level, at the municipal level, at the state level, and at the individual level. And I think the value of anecdotal information is variable at each of those levels. When it's anecdotal evidence between a provider and an individual, very valuable as far as informing the care plan. Anecdotal evidence for planning programs or policies at the state level, not as valuable. So thanks for raising that.
And one more question.
Well, I have a question, just a comment. And so when the mixed method approach works the best. And the reason why I say that is because when we do our surveys and we're collecting certain data, there are certain population groups that don't even get to respond to those surveys. So you're still getting biased or swayed data, depending on how you're collecting that information, right? And so every population group doesn't get to respond to the formalized data sets where we collect data. So for instance, the population that you mentioned, populations where English is not their first language, or they're illiterate, or they don't know, where am I supposed to take this survey? Or I don't have access to whatever type of application you're using to collect that information. The hospitals, after you go and have anything, send out a survey. There's some people that'll complete the survey, usually the ones that are a little upset about whatever happened. And then there's some that will complete it because they had a really good outcome. And so any way we look at how our data is collected, we have to think of it as a both and mixed method. The anecdotal data is really, really helpful when it comes to our legislators. They want to hear the story. Sometimes you'll go and you'll present all the numbers, like, I want to hear a story. So then you get the stories lined up. We just had an event where we did a city academy. So we had community members come into the health department. The municipality did it. So they went to every division and department to learn about what we do, because people don't know what we do. And so we had a bunch of folks that are there, and this one guy says, so what is your measure of 100% success in public health? I'm like, that does not exist, but I will tell you a story. So then we tell them a story about this case that we worked on. It took us 1.5 years to help an individual. So when we look at outcomes, that might be like, well, it took you guys so long, that doesn't really count. But this person is now living successfully, has an apartment, has weight on, sent us a picture, has weight on. That was success for me. He goes, well, that was one story. I was looking at data. I said, if I'd shown you a bunch of data, you would have asked me for something different. So we have to think about what we need. Who is the data for, right? And so if we're looking at it for legislative policy making, they're going to ask for certain data a certain way. If it's for the population, they're going to be looking for certain data. Because I used to always say, when I saw data, my story isn't in that number. Who did you interview? Because that's not me. That doesn't represent me. Right. And so I think we're trying to figure out the best way to collect data that's going to be the most useful for what we intend our outcome or whatever story we're trying to tell.
I get to finish with a comment, but I just think that's what's so wonderful about this group is that we have people from all elements of the healthcare system that can come together to solve those problems. I think it's a really valuable group. Thanks.
That was the opportunity.
Yep.
Good morning, everybody. Megan Feixler. I will keep our comments short because I know we're moving on to other things. But I am a community hospital representative for this group. I'm from Wentworth Douglas, and I have the privilege of being asked today to talk about this opportunity.
Step back quickly.
Well, our most recent, we've had really very rich discussions over the course of our work group meetings, recognizing the very difficult circumstances we're in currently regarding funding cuts, policy changes. We really felt it was important to focus our most recent discussion on how do we maintain that foundational safety net to maintain any sort of access and really focus on how do we maintain anything to improve our health status and outcomes. So we really focused our last discussion on that foundational need to maintain Medicaid services, as well as funding and services pertaining to mental health, community health, really those groups that are going to be disproportionately impacted by some of these changes that we see occurring. So that was really where we focused. We also had a very good discussion around something that I think Andy said at our last meeting, which was the being able to maintain Medicaid is going to be much more cost effective in the long run than some of these cuts, just because of those cuts and the effect that they will have to access and health status. It's going to be more expensive in the long run. And so really making sure that we have a way for people to understand what that impact would be, whether it's anecdotal, like we're talking about, whether it's the scope of the data. One of the other very rich discussions we've had over the last several meetings has really been focused on the barriers around affordable housing and the impact of that. And so one of the recommendations that we made that we would really like to see reflected in the annual report is helping people to understand that we still need to focus on housing. We still need to focus on things like specific areas like recovery housing and things, but to understand some highlighted facts and figures around the scope of the issue and what that impact is.
One of the data points that we talked a lot about that we were very concerned about was the fact that 49% of New Hampshire residents spend over 30% of their income on rent. And 24% spend over 50% of their income on rent. So really making sure that people understand some of those very key facts that contribute to kind of the scope of the overall impact. And I'd love to have any feedback from the rest of the group if there's anything else they'd like to add.
Good job, yeah.
Any questions?
Well, thank you for presenting. Question regarding the housing piece. So in terms of facts and figures, seems like there's a lot out there between elite organizations, between Bill and Invest as well, just like staggering. And I just don't know how much additional information will sway those in terms of who, like, what is out there in terms of persuading those with local control to change zoning laws, state level, to do anything else. Like, what the anticipated goal and hopeful impact of further information would be beyond what we already provided and is publicly available to voters.
I will provide a little input on that, and thank you, Megan. I think what you just said is really the continuation of our collaboration and partnership. We did, like, if you look at the history of housing, how usually they form with the business industry, now the collaboration with BIA, and the increase of, I don't know, advocacy in the state house. The good news is that we always say that people who we elected to represent us at the state level always sees the importance of housing, but now their agreement on what that looks like is where they are struggling. So I think, to answer your question, is really continuing the collaboration and the partnership and bringing voices together, because we all here said that housing is very important and it's a health determinant of a good living. So I think nobody, doesn't matter what industry you work on, should take their hands off when it comes to the housing. Of course, local control is something that only the people that elected, I'm one of them, that are elected in the city of Concord, you guys have that power and authority to help that happen by keeping, I don't know, reaching out to your elected officials in town, because that's the only way we can make this move. But we were very pleased this year and previous years to see the collaboration. And Ben Frost was sitting here talking about it, I think, one time, where we see a movement of industries coming together. And when I say industries here, I mean every aspect from healthcare to small business owners to people in the housing or whatever industry you work in, to see the importance of housing and move together. Yeah.
I think this is also, we had some discussion about this work group keeping the pulse on some of the conditions of health and conditions of thriving. So we talked about education, housing, obviously keeping it the food access, and just recognizing that there's a whole approach to it as well, and wanting to keep the pulse on that in terms of, especially in light of the crisis we're seeing.
If I could just add to that, I think the benefit of highlighting the safety net concerns from this perspective is that we are a body focused on health. And housing is seen from multiple different or through multiple different lenses. It's clearly a priority for people with different perspectives and represent different views. Nobody disagrees that housing and lack of housing is an issue. But I think our unique perspective is that it has, the lack of housing is a social determinant. It does have an impact on health and cost as it relates to being unhoused or underhoused. And so I think we bring the perspective of the impact of lack of housing on health, which is different than the BIA saying it's an economic driver.
That's correct.
Or multiple different purposes.
I wasn't going to ask this because you're gonna see how little I know about this, but in response to your comment, which I think is really important, sometimes to get your public health goals met, you have to approach them in non-public health avenues. And I am often in a very expensive part of the state. And what I see is we have quite a homeless population. We have struggling families and we have high-end condos that sit empty because they're second homes. I've heard different things, you know, sometimes there might be some tax evasion or tax rules that allow you to claim residency in New Hampshire and be free of some taxes. There's also a homestead something or other, which in some states may have, and it may be that if this is your second home, you pay higher taxes and it reduces the cost of housing for the general population. I don't know enough about this to say anything intelligent about it, but there are questions that do keep coming up. And so I don't know if we have any liaison on economic means or on housing means that are not in the public health vocabulary that, you know, we could work together with people on maybe those ideas. And I know changing anything with taxes in New Hampshire is like, but so those are questions. I just don't know if we can't do something along those lines.
Just a quick comment, we're very good at lowering taxes. We're not so good at. I shouldn't have even said that.
I just have one,
Recorded.
All right, fine, I said it.
I have one comment to make in response to that, and you're right, we have to play in like all the fields. So if we just stay in public health, we're not gonna advance what we need for population health as a whole. So there is one book, so I always recommend books to everybody, and they're like, and you can do it by Audible, because I've also been told, I don't like to read, so do the Audible. So there's a book that's called Homelessness is a Housing Problem, and it talks about the structural factors that explain what we're seeing right now. We've actually had Rob Dupees,
Yeah.
right? So he is one that we can have. He's read this book, and he and I have he was reading on it together. But anyway, so this is a
So
really,
housing is what?
it's called Homelessness is a Housing Problem. And it's by Greg Colburn and Clayton
Okay.
Page Alden, and they're actually working across the country in different states, and they do it by cities and towns, because they're as they've done this research, what they found is that sometimes you can't do a broad sweep of a state and pass legislation that you think every single town and city is gonna comply to, but you have to look at it city by city, town by town. This is a really good recommendation. I would ask, I mean, if we can, maybe we can have Rob come in and talk, you know, to our group about how this works, but it does impact health, it does impact public health. We're starting to see so many people now lose their housing, because I know we have the statistics of 25%, 30 or 50. There are people that I know that are paying like 90% of their income, so it's a fixed income trying to pay for rent. And so that data maybe is collected somewhere, but again, we hear about the other percentages. But I think that would be a good way for us to hear and learn how we play in these other fields. And so 3 years ago, with working with some of the homeless populations, when I had to take this deep dive and I found myself in a housing meeting, I just showed up and I'm like, oh my gosh, there's so much stuff I don't know. So I kept going to those. And so we have to, and I know we can't be in every place at every time, but we do have to make those kind of connections and relations outside of our public health sphere in order to get a better grasp on how, as population health as a whole, how we achieve what we want, but we gotta plan also with other places. But I would say, if you don't like to read, it's a good read and it's quick because it's so good. I would say to do the Audible. And there's also a little video on it, I could send a link out.
I think going back to some of the anecdotal is sometimes when we're looking at the data, we also have to be able to segment it. So I come from a small, fairly libertarian town, and the planning board had to say, you know, everybody was like, we don't have a homeless problem, or we don't have a housing problem. And it was like, we brought somebody in to have that discussion. But then how do you change the mindset in that small community? I almost feel like we need larger and smaller community in any bills. It needs to consider the ranges, right? But we actually took it from a value perspective. And it was, there's not even enough housing for your children to stay here. And that was like the first way that we got in. And so the anecdotal had to match the other data enough for the people to care. And then we started to move the needle, but it took But now there's some of the legislation stuff that's coming down again, without right-sized legislation, it puts us in a tough spot.
So I want to add one thing. St. Anselm College has what they call speaker series, and this is where really they bring all expert either in the economy field or in the healthcare or policy, most policy and economy. And they have that series that are coming up. So once we have a set date, I will send them to all of you guys. I think it will be very beneficial. And one of the book that you just recommended, one of the authors were really looked into bringing him to speak. I think he spoke, Phil, correct me if I'm wrong. Did he speak one of the New Hampshire housing conferences before I came
I'm not positive.
Okay.
Jess, you went to the last one, I think.
I don't believe he was at the last one, but
Yeah.
maybe prior years.
Okay, so Rob does a great job trying to identify all those good economists or policy expert out there to bring to this. But the St. Anselm College created a role for Alyssa Morgan as a director of housing initiatives. So I think there's a big movement in New Hampshire that is here to educate all of us on importance of housing. And as I said earlier, the importance of collaboration and partnership on all aspects, like all industries.
You know, I really hate to interrupt this because it's a really great topic, it really is. And so as my role as chairman, we need to go on to the next thing, but I will say two things. Number one, it would be really fun. I don't know if you guys are interested, but have a much longer day to talk about these issues, because a lot of good stuff just came out.
Yeah.
And if you could like forward all those names and everything to me or Palmera, Kristen.
Go into the minutes. We'll put it
Yeah,
in.
yeah,
Okay.
please put
That's
that in, because
important.
that's really important. This was really wonderful, and it is a great group, and I'm honored to be your chair. Thank you very much. We need to go on to the next section because we allowed 90 minutes for that, if I remember correctly, so I failed in my first share. I did want to say one quick thing, though. SB 190, we didn't mention that earlier. It had passed the House, passed the Senate, which means we'll only need 1/7 present for a quorum if the governor signs it, which I'm sure she will. So quorum will be a lot easier, but I'll be honest, this is much better to have people in person. It works way better if people can do this, so. Anyway, so let's go to the next thing. We've been alluding to the budget, the entire discussion. So now we're gonna get to hear from the experts about the challenges that we're facing. So congratulations, Phil, Jess, and Whitney. I have just elevated you to expert, which means there's no funding for that, but you can put that on your name tag. So I'm gonna leave it up to you to organize how you want to present, but Phil, you're gonna go first.
Yeah, so Jess and I will split it, hoping everyone can share my screen. Jess and I have prepared a presentation where we provide an overview of the state budget, which we're going to try to do in 30 minutes. And we're gonna split this slide deck. So for those of you who are online, Jess is sitting right next to me. So if she smacks me because I haven't advanced the slides quickly enough, then that's why that's happening. My name is Phil Sletton. This is Jess Williams. We're staff at the New Hampshire Fiscal Policy Institute. NHFPI is a nonprofit independent policy research organization based in Concord. We examine the state budget, state revenue, the state economy, and the economic security of granite staters, particularly those of us with low and moderate incomes. And what we're going to talk about now is where we are in the state budget process, what is in the state budget currently, although it's not updated as of yesterday. But what is in the state budget currently, and where some of the key, particularly health policies, sit relative to the state budget. Now, as a broad overview, when we're talking about the state budget, what are we talking about? We're talking about the funding for the state's operations that last 2 state fiscal years. So the current state budget's a 2-year state budget that funds state operations about $15.2 billion that were appropriated, and ends June 30th. So the state needs some new form of spending authority to fund the most, but not all, operations that are funded through the state budget after June 30th of this year. It has to balance based on revenues that come in during that that time period, those 2 fiscal years, as well as any surplus that's carried forward. That happened in the current, for the current state budget, probably won't happen for this state budget. And about 32% of the fundings, roughly $1 in $3 to fund state operations, are federal dollars, and that flow through the state budget. There are again operations that are funded outside the state budget. There are capital projects that are bonded through other pieces of legislation with state borrows money to do them. There are federal funds that flow outside of the state budget, but the state budget funds most of the state's operations for those 2-year periods. And there have been a couple specific bills that are mentioned. One thing you should know about the state budget is that it's actually 2 separate pieces of legislation. House Bill 1, which looks like what you might envision a budget to look like. There are a lot of line items for specific purposes. And House Bill 2, which is the omnibus policy text that goes along with it. So if you hear about a policy or a separate bill that is attached to the state budget, that is in House Bill 2. At least almost all the time, it is in House Bill 2. So the state budget is developed over the course of a year, actually a little bit more than a year, even though it's just a 2-year state budget. The state agencies started their work last summer, putting together their budget requests. The governor then processed those requests and proposed her state budget in February. The House then put together its budget proposal and voted on that in early April. And right now we are in the Senate phase. Once the Senate completes its work, there doesn't always have to be, but there will probably be a committee of conference where the House and the Senate work on a single version of the state budget that will then go back to both chambers for a vote and to the governor for her consideration. So right now we're in the Senate phase. And you'll hear us in this presentation talk about the governor's phase and the House's phase and what the governor and the House have proposed, or what the governor proposed and the House changed, as well as a little bit of what the Senate Finance Committee has changed so far. What's in the state budget? There are 6 broad categories of state expenditures. And so this is your $15.2 billion that I spoke about, divided up into those 6 broad categories that encompasses all state spending. You can see health and social services, which is essentially, not entirely, but essentially the Department of Health and Human Services budget. The Veterans Home, a separate agency, is also in there. That's 44% of state appropriations. And then education is another 23%. So about 2/3 of the state budget is health, social services, and education combined. That includes federal Medicaid dollars, that includes pass-through dollars that go to local public school districts from the state. And you can see the remaining third, justice and public protection, transportation, resource protection and development, general government, includes a lot of state agencies in that remaining third. Now, when policymakers are thinking about how they're funding the state budget, they're not typically thinking about those categories of expenditures. They're thinking about where are the funds being drawn from. And one of the things you should know is that not every pot of money that those funds are being drawn from is as flexible. So as flexible as every other pot of money. So the most flexible set of dollars are general fund dollars. And those are dollars that are raised through state sources and that policymakers can deploy essentially how they see fit, right? Essentially how they would like to in legislation. But there are other funds, such as the Education Trust Fund, that are for dedicated purposes. Those purposes can be changed in statute. Some of the funds are constitutionally protected, such as some of the highway funds. Those can only be used for highway-related purposes if they're raised through, for example, taxes on gasoline. So there are some constitutionally protected revenue sources. But this is often how, when people are thinking about the state budget, they're often thinking about either where these funds are drawn from, a certain subset of these funds, particularly the general fund. Most state budget discussions that you've heard about are about general fund dollars. And federal funds is, you can see the largest slice of this pie, again, at roughly 32% in the current state budget. Now, going into this budget cycle, there were some pretty substantial fiscal challenges, fiscal headwinds that the state faced. One is the repeal of the interest and dividends tax that was effective January 2025. That tax generated about $185 million in revenue for the general fund last fiscal year, and that's not going to be collecting revenue anymore. The phase out of that tax was put into law first in 2021 and was accelerated in 2023. There are also reduced revenues from the business taxes, and those are in part because of policy changes, but also in part because of the broader economic environment. There's a little bit less corporate tax, corporate profits that are being collected, at least based on activity within the state's borders. The state is also earning less cash on interest holdings because the state was earning interest on cash holdings that it had, but those cash holdings are smaller now. There's also some significant potential costs. There are charges against the state and the settlement processes with the state related to allegedly terrible things that happened over decades at the Youth Development Center and associated with contracted agencies that were purportedly caring for youth in the state. And there is more than $1.1 billion in pending filed claims with the settlement fund. There's also that's outside of the lawsuits that are happening. So there are also lawsuits that are being settled outside of the settlement process, which are an unknown amount of money. So when you're thinking about that state budget picture being $15.2 billion for 2 years, and we're talking about more than $1 billion here in claims, it's a significant fiscal consideration. And there's also some pending litigation in front of the state Supreme Court related to education funding. When there were education policy decisions made in the 1990s by the state Supreme Court, that did lead to some significant funding changes as well. There's a new state prison for men that parts of the project have started, not the physical construction, but the planning. That's potentially $500 to $600 million. That won't be all in 1 year, but there'll be bond payments over time. And there are changes to federal funding for state operations that could happen, right? And that's something that's being discussed at the federal level even this week. So that's another potential shift in how the state budget would be funded. Now, in the governor's budget proposal, generally the governor's proposal, and this is speaking with a very broad brush, but generally the governor's proposal sought to keep state agencies funded at roughly their current operational levels. There were definitely places where there were increases and decreases, but overall it was a budget that didn't dramatically change state operations, except for in a few key areas. One is a boost to the New Hampshire retirement system for certain police and firefighting personnel to receive benefits that they previously would have, but with a law change, lost those benefits back in 2011. There's also increased special education aid to school districts, a really substantial increase, 47.2%, which is actually in line with what school districts are reporting as their increased education expenses, so not overshooting it. There's also an expansion of education freedom accounts and access for families who are using the dollars that would have otherwise gone to public schools if their child was in public school for that child, using them for other education-related expenses. There's an increase there, a roughly 4% decrease in the budget for the university systems. Establishing a solid waste evaluation committee was a policy proposal the governor included in her budget. Expanding revenue with video lottery terminals, and also having the relative favorable revenue projections. Those funded the governor's proposal. And the governor didn't include any funding for the Youth Development Center settlements or lawsuits, the state prison for men, or associated with possible changes for federal funds or education funding. Not that all of that was necessarily something that you would anticipate in the governor's budget proposal, but given those fiscal considerations we had going in, I think it's important to note. I'm going to pass it to Jess.
Thank you, Phil. So the governor's budget also.
Take a breath. You're doing okay with that. Take care. It's really important.
We'll slow down. So the governor's budget also included a number of key changes related to health and policy and both monetary changes. This included about 10 million allocated across the biennium for uncompensated care funding at community mental health centers across the state. The governor also increased funding for homelessness services, particularly maintaining increased rates that are paid to shelters for providing services, as well as allocating an additional 10 million across the biennium from the opioid abatement fund, to support those with substance use disorder needs. Overall, there was a funding decline for services among older adults and people with disabilities. However, those funding changes vary greatly by service area. In particular, Medicaid funding towards nursing facilities did see a large increase, about 23% in the first year, and a smaller increase, about 7% in the second year. On the other hand, there was a decline in funding allocated for the state's Choices for Independence Medicaid waiver program, which provides in-home and community-based supports for older adults and adults with physical disabilities. Overall, the budgeted amount for developmental disability services did see a decline in its budget line. However, the governor did add in a couple key footnotes that permitted some carry forward of funds that were unspent in prior years. Overall, the Division for Medicaid Services did see a large decrease in their budget. This was largely due to an expired agreement around the Medicaid enhancement tax.
and the number that hospitals receive back for providing uncompensated care. Under the governor's proposal and also in the House's proposal, funding for the hospital uncompensated care pool would decline by about 61%. And finally, Hempstead Hospital was removed from the state budget following its approved lease over to Dartmouth Health at the end of last year. And the governor also proposed adding cost shares for Medicaid enrollees who we know are typically enrolled in public health coverage because they cannot afford other private health insurance. Under the governor's budget, a federal waiver would be sought out to establish premiums among the Granite Advantage program for enrollees with incomes at or above 100% of the federal poverty guidelines. The state's Granite Advantage program is funded outside of the state budget, so any revenue collected from these premiums would be funneled back into the healthcare trust fund, bringing about $12 million in state fiscal year 2027 alone. Premiums would also be established for the Children's Health Insurance Program among households with incomes at or above 255% of the federal poverty guidelines. Separate from the Granite Advantage program, any CHIP premiums are factored into the projected general fund revenue, meaning that any estimated revenue from these premiums can be used outside of DHS funding and essentially anywhere in the state budget. According to some federal guidance and restrictions, both premiums for Granite Advantage adults and CHIP enrollees are limited to a maximum amount 50% or 5%, sorry, of the household. While the governor did not propose premiums for other Medicaid enrollees, she did propose increasing prescription drug cost shares from its current $1 to $2 up to $4 for the upcoming biennium. And it's important to note that any administrative changes to the state's Medicaid program do require state plan amendments. These would be required to be filed by January 1st, 2026 for the CHIP premiums and cost shares, as well as by July 1st of next summer for the Granite Advantage. And with that, I'll turn it back over to Phil.
All right, thank you, Jess. So one of the key differences between how the governor was able to build her budget proposal and how the House built its budget proposal was a difference in revenue projections. Remember, those revenue projections over the next 2 years matter a lot for how the state budget can be operated. So here you can see that the House's revenue projections for the combined general and education trust funds, I showed you that pie chart for a reason. Those two funds share many of the same funding sources, and that's where most, but not all, state tax revenue goes, and it can vary quite a bit over time. So here you see the actual and projected revenues that came in fiscal 23 and 24, and then the projected ones for fiscals 25, 26, and 27. Note the graph doesn't start at 0, so I've zoomed in so you can see the changes, but the governor's projection is in orange and the House projection is in green. And that gap in total over the rest of this fiscal year and into the next 2 was a little more than $500 million in revenue decline between what the governor had to work with for revenues and what the House did. So the broader consequence of that is that, well, it's not quite 1-for-1. The governor's budget proposal, which you can see there is the second from the right, that bar, was about $16 billion. The House's budget proposal was about $15.5 billion. There's a lot that went into that. Again, it's not quite $1 of lost revenue for $1 of expenditures, but you can see that is relative to the state budget request from the state agencies, which totaled about $17 billion if you were to add up all of the state agencies identified as a need or potential expenditure. And the current state budget, if you do an accounting adjustment, it's that to make it a more of a 1-for-1 comparison, was about $15.4 billion using the same accounting that the governor and the House used in their proposals. However, note that's not adjusted for inflation. Right, so $1 buys you less in state fiscal year 2024 than it's likely to in state fiscal year 2027. So when it comes to actual services delivered, if it had been the exact same amount, it would be paying for fewer services. The next budget would be paying for fewer services than this one would be. And these are the key changes, or the largest magnitude in terms of dollar changes between the governor's budget proposal and the House's budget proposal. Now, we'll go into these all in a little bit more detail, but this is sort of all on one slide what some of those biggest shifts were. This is not encompassing policy, this is not encompassing every shift, policy changes, I should say, in House Bill 2. It's not encompassing every shift, but this is where the biggest dollar swings were. The Medicaid reimbursement rate decrease, you can see there's the orange bar, which is the state funding change, and then the minimum amount that the federal match change would be, because it's at least a 50% match in Medicaid. And developmental services waitlist funding. So this is, and Jess will talk about these in more detail in subsequent slides, but you can see there's also that 50% match there. Funding for the university system, you can see that decrease of about 27% relative to the governor's proposal. There's what's called a back of the budget reduction, which I'll talk about a little bit more later at the Department of Health and Human Services and at the Department of Justice. There's a decline in mental health, community mental health supports funding of about $38 million, and 190 positions were eliminated at the Department of Corrections. So that's what you see on the negative side. On the positive side, in terms of funding, the House did appropriate $75 million more at the end of the biennium to the rainy day fund. It drew down more from the rainy day fund at the beginning of the biennium and left more dollars at the end, effectively not appropriated for anything else, right? These are general fund dollars that weren't used on anything in their budget plan, and as a result, went back to the rainy day fund. There's increased education aid to school districts, more of an increase for certain police and firefighter retirement funding than the governor had. They did in the House, put $20 million towards the YDC settlement fund, had a further expansion of education freedom accounts, more funding for public charter schools, and then put $15 million in that could potentially be used for childcare workforce funding in federal funds. So that's a federal fund change there. And for more details on that, we have some subsequent slides, and I'll pass it back to Jess.
So the largest reduction proposed by the House was a 3% Medicaid rate reduction for all Medicaid service providers in the state. This would require a general fund reduction of about $52.5 million across the biennium. And as Phil mentioned, likely at least equal amounts in federal dollars when we consider the 50-50 federal Medicaid match. This reduction follows a 3% across the board Medicaid rate increase that was included as part of the current budget biennium. This increase applied to all Medicaid providers in the state, excluding hospitals, with certain targeted higher rates depending on service area. In addition to that reduction, the House also proposed delaying payments for managed care organizations. Under current practices, MCOs typically receive payments at the end of every month. So instead of receiving payments on June 30th, 2027, they would receive those payments at the start of state fiscal year 2028 in the next biennium. In addition, the House also proposed a number of funding changes for the Granite Advantage Healthcare Program, which, as I mentioned earlier, is funded outside of the state budget. Included in these changes would be a repeal of the automatic 5% transfer, which occurs from the Liquor Fund to the Granite Advantage Healthcare Trust Fund. This occurs annually to account for any funding, potential funding shortfalls for the program. Under current law, general funds can also not be used for the program, so this would also allow for the use of general funds if there is a shortfall. Outside of those changes, the House did allocate $12.6 million in 2026 and $1 million in 2027. This would have been $13 million, but the House was under the assumption that $12 million will be collected in premium revenue taken from the governor's projections. The second largest reduction was seen among community mental health services. This would largely impact non-Medicaid contracts, as well as eliminate the $10 million that was proposed by the governor for uncompensated care across the biennium. Community mental health funds a large number of services, including transitional supportive housing, rapid response, 988, and other suicide prevention, as well as uncompensated care for both those who are uninsured as well as underinsured. Around more than 30,000 people were served during state fiscal year 2024, including a little less than 10,000 through global crisis services. The House also repealed the automatic 5% transfer from the Liquor Fund to the Alcohol Abuse Prevention and Treatment Fund, which provides funding for the Governor's Commission. To backfill some of that repeal, the House did supplement that transfer with opioid abatement trust fund dollars for the biennium only. The House also did fund some positions at Glencliff that were not allocated for in the governor's proposal. However, the House did require or call for the sale of various state-owned properties This included the Philbrook Center, which is currently being used as transitional housing for up to 60 folks who are currently already receiving services at New Hampshire Hospital, as well as the sale of the Tyrell House, currently being used as a shelter for those experiencing homelessness in Manchester. And the House also proposed a large funding decline for developmental disability services. This decline would largely impact the waitlist for services, so that includes any children who may be aging out of school-based care, anyone moving into New Hampshire who would require services, as well as anyone currently receiving services who may require increased or enhanced aid during the next biennium. The state has identified that 278 people are expected to age out of school-based services during the upcoming biennium and would likely be waitlisted under the House proposed funding levels. In addition to some of these reductions, the House also did carry forward 2 key footnotes that were included in the governor's proposal. This included the carry forward of up to $30 million in 2026 and $50 million in 2027, which you can see outlined in orange on the graph. However, these amounts are split under a couple of different budget lines, so the exact amount that would be dedicated to developmental disability services is unknown. The second footnote also allows DHS to go to the Joint Legislative Fiscal Committee to request more funds if spending exceeds the budgeted amounts. And finally, in addition to those 3 largest changes, the House proposed a number of other health-related funding and policy changes. Among the Division for Medicaid Services, the House established an incentive program to encourage Medicaid recipients to seek the lowest cost of outpatient procedure care when appropriate, as well as established a research study to measure the effectiveness of the adult dental program. The House also called for a number of eliminations and reductions among service areas. This included the elimination of all general funds for the Family Planning Program, which serves approximately 2,500 people annually, providing a number of reproductive and preventative care services. This is a federal match program, meaning that all eliminated general funds would also mean an elimination of federal funds in this case. The House also called for the elimination of all general funds that are dedicated for the tobacco prevention and cessation program, bringing in about $1.2 billion in savings across the biennium. They also called for the elimination of a contract for master licensed alcohol and drug counselors within DCYF, with a little less than 700 served in state fiscal year 2023. The House called for the suspension of the WIC Farmers Market program for this upcoming biennium only. And while it was not eliminated in its entirety, the House did remove all funds for the Prescription Drug Affordability Board. And then finally, under eliminations, the House did call for the termination of the state's Medicaid disclosure program if current parental consent policies around that program are ever changed at the federal or the state level. As far as reductions, the House provided an amendment that the state loan repayment program would not accept new applicants during the biennium. However, there would be continued funding for current recipients. This program helps to essentially recruit and retain health professionals to work in either rural or medically underserved areas in New Hampshire. And as of state fiscal year 2024, a little more than 100 clinicians were served through the program, including 94 behavioral health clinicians. And finally, the House also called for a 10% reduction to youth residential placements among both DCYF and the Division for Behavioral Health, bringing in a little less than 11 million in general fund savings during the biennium. I won't go into too much detail here, but in addition to some health changes, there were also a number of changes in funding for education. This included a decrease for public higher education, more particularly among the university system, which we can see represented in blue. When we look at the governor's funding and compare it to the House's funding, funding for the university system would decline by about $50 million or 33% across the biennium. The House also proposed reductions for the community college system, which we can see represented in green. And under the House's proposals, that reduction would bring allocations at about what they are funded during the 2024-2025 biennium. While there were some reductions proposed, it's important to note that the House set aside $5 million for the dual and concurrent enrollment program, which allows high school students to attend college or college classes for free at their local community college. With that, I will turn things back over to Phil to talk about the K-12 education changes.
Great. Thank you, Jess. So there were some funding increases for local public education. The primary increase that we saw in the state's education funding formula was that school districts that have a relatively small amount of property value per student and do not necessarily have as many children who are on free or reduced price school meals would receive more funding. So it's more funding distributed to communities based solely on relatively low property value per student. There was an expansion, as I noted before, to the state's education freedom accounts. This would be removing the income cap on that program, meaning that currently under current policy, it's capped at 350% of the federal poverty guidelines, which is adjusted by household size. That would be that or lower is the income that a family has to be eligible for education freedom accounts. This would make it so that any family at any income level could be eligible for education freedom accounts. And that's a switch from the governor, who had proposed lifting that income cap only for students who are specifically switching from public school to an education freedom account. Charter school tuition was also boosted. There's also one thing I do want to note about this funding increase. It did assume that there's revenue collection from relatively high property value communities. If anyone has any questions about that, given the time, happy to dive into that more. But know that the statewide education property tax would actually collect revenue under the House's assumption, although it's not specifically in the House budget proposal. And there is a cap on certain large school districts in terms of the amount of funding that can be received on community-based characteristics. That cap could potentially, based on the number of students, affect Manchester and Nashua, but it looks like it only affects Manchester. So Manchester would see a decrease in funding, whereas most other communities in the state would see an increase, depending again on the statewide education property tax. Now, watching the time, I will skim through this and say that there were many changes to fees, particularly fees at the Department of Environmental Services for things like terrain changes and dredging. And that is, as well as fees to for public water systems. Those are fees generally that the House either increased or retained and kept, although they removed the inflation adjustment. The House also would change the governor's proposed solid waste site evaluation committee, eliminate solar from the state's renewable portfolio standard. And if you have a question about that, happy to unpack that a little bit more. Add a solid waste management fund to help communities facilitate their solid waste collection and fund those efforts. Allocate $3 million towards public transit operations as well. This is something that showed up in general funds first in the current state budget and allows for a significant federal match. So that would be included in the House version of the budget as well. On the housing front, the governor had proposed those increases that Jess outlined to the housing shelter program. That was retained by the House. However, the governor had proposed extending the appropriation for the Housing Champions program. That extension was eliminated by the House. So the funding for the Housing Champions program that it currently has would expire at the end of this fiscal year. The House also proposed creating a Partners in Housing program as part of the Housing Champions program, which would incentivize workforce housing being produced. However, there was no funding for that. The legal framework was put in HB2. The House also eliminated a few agencies and also added a fair number of policy bills. So the House would defund and repeal the Office of the Child Advocate, the Human Rights Commission, the Housing Appeals Board, the State Commission on Aging, the Division of the Arts within the Department of Natural and Cultural Resources, and eliminate the advertising and certain administrative costs for the state's Grant State Family Leave Plan. Those would all be with the private sector entity that's contracting with the state to run that program. The House did raise a significant amount of revenue through increased gambling opportunities in the state, particularly those video lottery terminals and expanding them beyond what the governor had proposed, and also increased 90 fees in total across their state budget proposal. There were also 35 policy bills attached. So these were separate bills that were attached to the state budget in House Bill 2. It's a pretty long list, but I'll say in summary, open enrollment for school districts, meaning a student could be enrolled potentially anywhere in the state, not just within their school district borders. Alternative treatment centers for therapeutic cannabis could be for-profit entities as opposed to just nonprofit entities. Certain requirements for immunization for children would expire after June 2026, and certain vaccination rulemaking authority would be repealed. There'd also be a separate category of firearms with the intent of avoiding regulation under the federal government's interstate commerce clause. Multi-occupant bathroom facilities, sporting events, and correctional facilities the use of those could be required by biological sex, and that would not violate the state's anti-discrimination laws. There are certain prohibitions on diversity, equity, and inclusion funding, and that is defined in the proposed statute for state and local governments and school districts, with a risk of losing state funding for school districts if those activities occurred. Evictions would be permitted at the end of a rental lease without other cause. Currently, there has to be some other cause. State motor vehicle inspections would be removed, and there would be these membership-based or private pay health facilities that would be allowed to not provide care for all for required services regardless of payment source. So that's another framework that's in there as well. Now, I mentioned these back of the budget reductions. A back of the budget reduction is basically the legislature saying, we are providing you, state agency, with the state budget, with these appropriate amounts within these budget lines, but you have to find a certain amount of savings within those budget lines. So we're not going to tell you where those savings have to come from, but you have to generate those savings. You have to underspend your budget by a certain amount. So it empowers the managers of these state agencies to find those savings in the ways that they deem the most appropriate. However, we also don't know where the savings come from. Right? That is then in the hands of the state agencies. And with the exception of DHHS, there's not a reporting requirement for the other state agencies that are on this list in terms of where those how those state expenditure reductions affect public policy. So you can see the list here. I won't go through the list of all of them, but most of these are general fund reductions. And you can see they do vary substantially based on the percentage of general funds that the governor had originally allocated to these state agencies. So the Department of Health and Human Services is the top one and the largest amount with that $46 million back of the budget reduction. So all of those other reductions that we talked about, this would be in addition to those changes. Now, we're in the Senate phase, and right now the Senate Finance Committee is working on its state budget proposal. The Senate Finance Committee, as you can see, I've added more bars to these revenue projections. The Senate Finance Committee has a little bit more revenue to work with. It's about $265 million more revenue in the general and education trust funds than the House had to work with over the remainder of this year and into the next 2 years. So it's closer to the governor than to the House, but not by much. It's right about in the middle in terms of the amount of revenue that the Senate has in its revenue projections. Most of the Senate Finance Committee changes so far have been reversals of House policies. So it's not been a lot of new policy added yet. There have been some, but not a lot of new policy added yet. The 3% Medicaid reimbursement rate reduction was reversed, as was the reduction in funding for developmental services and community mental health supports. And you can see the list of policies that was illuminated from the state budget trailer bill. And so they were all separate bills, although Senator Waters also had a separate amendment. Those changes are essentially reversing things that the House had put in because those bills exist somewhere else and the Senate is considering them separately. So I don't know what happened with the State Commission on Aging yesterday.
It took no action.
It took no action. Okay, so this slide is still current then. So one thing I do want to note, however, because it's taken out of the budget by the Senate, it is still the House position. So those bills that you saw, even though this list of changes has occurred, if there's a committee of conference, then the House will still have those in its budget proposal when the negotiations are happening over the final state budget. And I'll hand it back to Jess to close us out.
Yes, I will try to run through this in 20 seconds, given time. I know we just talked through a lot of information, so I'll just leave you all with a couple of key takeaways. New Hampshire state budget funds most operations for a 2-year biennium period, totaling about 15 billion in appropriations, organized by various categories and by department or agency. The process for building the state budget typically includes about 5 stages, or phases rather. We are currently in the Senate phase, which is the second to last in the usual process, with the Senate projected to finalize their work by the beginning of June. There have been a number of challenges this budget cycle, however, that have made this budget cycle particularly more challenging. This includes the repeal of the interest and dividends tax, as well as some key potential expenses, including the particularly ones related to YDC settlements. We also know that any federal funding changes could impact the state budget. As we know, about 1/3 of the current state budget is funded through federal funding. The governor's budget proposal would maintain most agency budgets with relatively few changes in either direction, largely driven by more favorable revenue estimates, particularly among business taxes. The House's proposal would substantially reduce services, as we discussed, particularly among Medicaid, community mental health support, as well as enact more attached non-financial policies, which we just went over in the last couple of slides. And then finally, we are still fairly early in the Senate Finance Committee process. However, they've already made a number of key policy decisions and restored key health funding. And some higher revenue estimates could enable more expenditures and more decisions and more restorations over the coming couple of months. And you're always, of course, welcome to check out any of our additional resources on our website. We have a couple reports, webinar recordings. And I know you've probably heard Phil say this a million times, but you're also always welcome to sign up for our newsletter where you can receive weekly updates straight to your inbox. So we do have that QR code. You can also just go to nhfpi.org. Check out our work.
Phyllis, you'll send us the slides, we'll put it into the full pack, and then everyone will get this in a day. I know you're dying to get this stuff.
I just wanted to say that's HB2.
Wow.
That was an amazing presentation. I wish I had never read this. It was an amazingly good summary of what's a really difficult, complicated process. So the big reason for wanting to do this actually was this is the time to have input into the process. I think it's late for us as a group to do it. However, I mean, I kick the senator's legs every time I see him, you know, to let them know this is a problem, this isn't a problem, whatever. And this is the time to do it, to reach out to the senators, say why it is, and even reach out to the House people, because there will be a concurrence session. One of the biggest fears is that the governor won't sign the final thing, correct? That is a potential problem, and what you see could be dramatically worse than what we're seeing here. So there really needs to be something, and but this is the time to reach out as your organization and do it. I think we're really behind the ball for us.
I think the Access to Opportunity group really had a recommendation about this. Holly, I don't know if you wanted to say something. I'm gonna put you on the spot, or I'm forgetting what.
Have your notes.
Well, this group typically looks at the ability to thrive, that we couldn't lose the safety net component. It was something
That must have
along,
been it, it sounds.
To prioritize a particular, as opposed to everyone in their own little fiefdom, to really focus on the population that is the most needy and, you know, try to drum up support on that. A joint approach as opposed to a fragmented approach.
I think the real challenge is that, and David, you can respond to this. Right now, it's in the Senate Finance, everything's in the Senate Finance Committee. And so, you know, from the Commission on Aging perspective, we're really hammering those individuals. They've heard a lot from us, and from other advocates, but is to be as specific as possible about what bill you're speaking of, what line in HB2, because a generalized don't hurt people who are vulnerable is less actionable.
Yeah.
So some of the, you know, going back through Phil and Jess's slides, if there are specific places like Medicaid funding, that's a place to try to have some input.
Yeah, great. Sorry.
Would this be a good time to turn over to Whitney to?
Make it really quick, but yeah, it's kind of a drill down below the state budget to talk about how the Division of Public Health is being impacted
again, to think about how this group can be helpful as we navigate, so. Can you see my slides?
No, it's like a big mystery.
You have permission to share, you should be good to go,
Let's see, share. And then window. And I put her around, I'm gonna do share.
I just want to say while we are waiting for her, oh, it's up.
There it is.
You're the first to speak when she's done.
So I'll go very quickly. So my objectives, I was editing this in live time based on just the feel of the room. So I feel like that was a bit of a gut punch for people. It actually was kind of nice for me to hear it just because it captures like a lot of the stress that we've all been going through over the last almost year. So I want to talk about what could the role of this council be in weathering the storm, whether that's the last minute, Senate committee, conversations about the budget, or even just how we prepare for moving forward. And then I want to zoom in on the Division of Public Health, and you guys did a great job capturing some of the impacts of the state budget discussion on our specific parts of the budget. And then that kind of ties to our use of some currently available flexible funding, but again, I'll give a little snapshot of federally what's going on. I'm a very visual person, so you don't even have to read what's on the left because they all went over these different changes, but the crux of it is to say that it feels like we've been on a hamster wheel of just nonstop disappointing information, cutting.
For some reason, it's not.
It's not.
We're not seeing the presentation, we're seeing the open PowerPoint window.
Here we go, we will innovate.
Yeah.
We're doing nonstop right now. So I highlighted some key changes from the House version of the budget that are impacting public health that are probably relevant for this group. And again, we already went over the childhood immunizations, some major changes going on. State loan repayment program, we're actually working to modify the language in HB2, I think it's HB2, to allow us to use other funds, not state general funds, to continue to do those contracts for medically underserved areas. The tobacco program, if people are not aware, is completely proposed to be eliminated both federally and at a state level, which means just absolutely no tobacco work in terms of public health. And then I don't think you guys talked about it, but this is really significant to us. And so I did a screenshot of a pie chart from your slides. That gray piece of the pie are other funds. A lot of our public health programming comes from other funds. Like, for example, the therapeutic cannabis program is funded through the actual certification of individuals who are on the program. We have 16,000 people in the state who use therapeutic cannabis, and that funds the program. And right now there's a proposed 5% surcharge on all dedicated funds. So they're going to cut from all of the dedicated funding for health programs to just throw into the big pie. And that's happening on a number of different public health programs that are already strapped for resources. I just wanted to tie in the federal budget, which we can talk about more and is probably more relevant in the fall, but this one feels like a roller coaster. So we've had things with sudden cuts. This is the list that just got eliminated actually overnight and 2 days retroactive. So and again, at least the state process has been orderly. The federal process has been a roller coaster. So we've been just sort of every day is an emergency, just trying to figure out how to stay, open. We've also, I put at the bottom of the sudden cuts, just our federal partners. So we don't have people answering phones. We don't have people being able to tell us whether we can expect funding. So every day we plan for laying off people and for continuing the work moving forward, which is just exhausting. The proposed cuts, and this was somewhat from the president's budget, but then even leaked documents at a federal level, have pretty much proposed elimination of the majority of grants that work on chronic disease, anything related to primary care, rural health, HIV. There's a little bit of hope that there's going to be a consolidation of those things into this new Agency on Healthy Aging, but CDC has been relatively gutted. So it will be infectious disease and epidemiology moving forward, and we're still waiting to figure out where the rest of our stuff ends up. Similar with HRSA, again, all of those healthcare infrastructure grants are just teetering on potentially disappearing. So I wanted to give a little snapshot. So right now, we still at the Division of Public Health have a couple of grants that are pretty flexible for us to be using, whether it's to plug holes and fund things that are not funded at a state or federal level. They, back in a good day, were also supposed to be to fund innovation and emerging issues that were identified. I don't think we're in a time like that anymore, so it's really more life jacket type funding as opposed to innovation. But so this group has been charged with being the advisory group for that grant funding, and so I think this will be the second year that we're presenting here. And the first step around us engaging this group around decision-making of how we use the preventive health and health services block grant is for us to just give you guys information about how it's currently used. I wanted to give, again, just like a really basic visual. So it's the pie chart. It's funny, the legend is flipped, but the blue piece of the pie, which is slightly less than half of our block grant funding, that just goes to support salary and personnel at the division. I'll go through some of the different areas of work that those salaries are in. I will say that it is not 100% of pretty much anybody's salary, so we're just talking dribs and drabs of over 40 staff at the division. And then the orange slice of the pie is what goes into contract and ultimately goes out into the community to help support our partners in doing public health work. I would love to see that orange slice be like 75% or 85% of the pie. And maybe we can work towards that, but for now, I just wanted to give that transparency of how it gets divided up. So let's see, let me go to the next one. So I wanted to talk through how we currently use the grant, and I wanted to use the State Health Improvement Plan as a sort of lens for thinking through that. So if people can remember, I took a screenshot. We have these 4 what we call the universal conditions that we wanted to make sure were considered in all of the work of the SHIP moving forward. So eliminating inequities was one of the first universal conditions. And I would say that in the block grant, and again, happy to do more of a deep dive later on with this group, every activity is focused on a specific health objective and at reducing inequities related to those health objectives. And again, I'll go through them on my next slide. Another key piece that this group and the SHIP emphasized was leveraging cross-sector partnerships. And so currently the block grant has been used to help support the Shaw SHIP Council. So you see that and the dollar amount associated. And this is over a 2-year period to just bring together this group and do the work that we're doing. Another piece of the funding goes to support our public health advisory councils or FACs and the work that they do at a local level to be coordinating cross-sector partnerships. We said that we should have a focus on innovative or novel approaches. And so the department has invested a fair degree in quality improvement and being able to enable us to be using data and research to improve upon and innovate the work we do. The 4th condition from the SHIP that was laid out was that it ought to be grounded in data. The conversation earlier today was a great kind of segue to that. And so the department has used some of this funding. None of this funds anything in entirety. So again, it's dribs and drabs. But the block grant does support the DHHS data portal, or what some people referred to as Wisdom earlier, which is one of the public facing ways that we get data about health outcomes and at a local level. So we put some funding towards that. We actually have to end up using the block grant to fund what's called our behavioral risk factor surveillance system, which is a national data system where we also get state level data to understand health outcomes. I love the conversation about the pros and cons of those and the sort of benefit of the qualitative data and like supplementing it. And so somewhere down the road, we may need to think about what's the right size of funding for purpose and how to supplement it with other, data collection. And then another piece is that and it's not exciting, but we use the block grant to fund our access to actual academic journals and publications so that we can be grounded in the data around what is effective. And so there is a cost to that. So 17,000. So in terms of the use of the block grant around the 4 domains that are in the health improvement plan. This felt like a reach, but after the conversation this morning, I feel like it is the right location. So for access to opportunity, I put under sexual violence prevention. We have a little mandated set aside amount that we put towards that, but when I think about housing and housing security, having a safe place to live and being able to make the decision to leave an unsafe place for living is actually an enormous access to opportunity thing. And so thankfully we fund that little sliver of work. In terms of the community domain, we fund our health officer, infrastructure. I'm looking at Kim because I know you've worked for years in that, role in the Portsmouth area. Again, not a lot of money. It doesn't even fund a full position, but it's this, we have an individual at the health department who then works with, I think, over 200 health officers who work at a town level. I recently have been somewhat joking, but it's a really serious thing. They're sort of like they're the ones who go out when your waste system or your neighbor's waste system is not working. They're the ones that make sure that pools are safe to swim in. So they're really a key part of just basic public health infrastructure, and they don't get funding from anywhere else. We also use some of this to fund food protection work that we do. So again, I've recently been joking that we need to be less jargony in our language here. This is just making sure that you don't get sick when you go eat food someplace, which is a pretty fundamental piece of health and health infrastructure. And then again, not like it's super, jazzy, but rabies and shellfish poisoning testing. We don't have funding from anywhere else. And it certainly is nice to be able to determine whether an animal has rabies and be able to mitigate harm from that. So again, we dedicate the flexible funding for that. For health status and outcomes, there's still funding of our infectious disease work. There are just certain types of infectious diseases that we don't get funding for, and we can't use our federal grants to fund. And so I've listed those. Hepatitis A, pertussis, TB, and then some of our gastrointestinal outbreaks. Cancer registry. So going back to the conversation earlier about data is expensive. The more and more cases of cancer we get as a state, and the more and more we age as a state, we will have more and more cases of cancer. There is a cost per cancer case to maintain a cancer registry, and year after year it goes up, and year after year the funding from the feds stays the same. So we have patched together our cancer registry funding, but again, it's not an insignificant amount of money. And then the last thing around health status and outcomes that we fund are school-based sealant programs for oral health. These are just a phenomenal program where we actually send hygienists into schools to work with kids who otherwise will not access a dentist. And so this has always been really broadly supported, but again, it's taking our flexible funding and allocating it towards this single thing. And then this might have been a reach, but I put social connectedness. I listed injury prevention under there. I think of it from like an aging perspective. A lot of our work is around falls prevention. Actually, our conversation earlier about like keeping active and being a catch amongst your demographic. Like this is all about being able to continue to be out and in your community and engage in the activities that you want to engage in. And so, social connectedness, that's one way that we're supporting it with the block grant. So I know we're at 11 o'clock. The next step for me, because this is a lot to think about, is that I will send out the current budget for this work, and then I will send out our proposed use moving forward. I think the headline is it's probably going to be maintain the same funding, because I'm not sure there's anything that can truly be cut. The sad information is that we're getting less for our block grant this coming year, if we're funded at all, fingers crossed. Right now, again, think roller coaster. Right now, it looks like we're fine, but who knows? But I did want to at least just kind of tie it back into the support that we've had for the SHIP Council. And just let people know that, so the department right now has been funding the facilitation of this council group through contract with Brandeis. And so given the cuts, this is one of those places where we had to shift funding into community-based programs and supports. So moving forward, this group will have to think about how do we continue this like amazing momentum. I'm so struck by like the fact that we are all sitting here with our laptops and have finally figured out like a really good cadence to hybrid meetings. But again, I did want to at least just share with people that Kristen and Palmyra are going to be working with us through the end of the fiscal year, which will be June 30th. And we want to make plans for how to continue to support this group moving forward. Because I personally have thought that, you know, you guys have done a phenomenal job.
That was my special announcement. I don't need to make it. I guess second, thank you very much for everything.
Thank you all for unpacking this and educating us, but I don't even know where to start when I listen to the budget, because I had somebody who has somebody at his house. So one of our community member has people with development disability at their house that they care for, I don't know, 24 hours. And they wondered if this budget go through, how this person will be affected. So I couldn't answer that question, but listening to what you guys just shared, I was just sharing with her that it sounds like you're not in America. I'm sorry.
So if I could just make one comment, and one of the people in finance in the House announced this very publicly, and he said, this is a horrible budget. But we have a statute that says revenues have to match expenditures, and this is the best we can do. I would have loved to have a lot more time to talk about why the House and governor's revenue numbers were so different, because that made a huge difference. But they said they didn't want to do this, they didn't want to do that, they didn't want to do this, but we don't have a choice, we got to do this, this, and this. So, and we don't even know what the federal numbers are, which will have a dramatic impact on whether we even have Granite State Advantage program later this year. So, I mean, it is a scary time, and this was packaging it all and making us much more scared. I'm thankful. I'll go consult my counselor on the way out the door, but the next step we really have to do is, I guess we're still involved with planning when we're gonna meet again, how the subgroups are gonna meet again. That's like the big next step. And the leadership meeting is the plan, the next, where we go from here, but we've generally been meeting every 2 months.
Yes, every other month. If you want to continue to do that, and then it gives a chance for the work group to meet in that other month where the larger group is meeting. Yeah.
So it would be a summer meeting. I don't know how people feel about that. To have the next meeting. This was amazing that everybody was here. Thank you very much. It really makes a big difference.
If you don't have a lovely Stanley Cup, please get one, because I don't want to take them all back.
Oh.
They're quite heavy, but they are beautiful.
Oh.
Nice, keeps your drink cold.
Oh, nice.
Help yourself to a donut.
So David, when is our next meeting?
So we have two choices. We as a leadership group can figure that out. That'd be better than, but we're gonna be meeting soon.
Yeah.
So then we can let you know how we wanna do that. Is that fair?
Yeah, I think I have, we're not gonna leave here with any kind of emotion, and I'm not sure we could pull that together. But I do think that I'm gonna just say the thing, is that if this was a household budget, I think the legislature would be making different decisions. Is if we said, hey, we have a sudden drop in revenue, we would not be looking to change things that we don't need to change, that are nice to have. And so I think part of where I struggle is that I see housing, health, and education. And if we can do no harm on those things and not change anything that doesn't have to be changed, that would allow us to keep some of the things that are fundamentally the safety of it.
Yeah.
And I think that's where I would just give you that input in my limited ability to influence legislators in this room. And I'll continue that. I just don't know how we say that enough to say, if this was if this was truly our family and what are our values as a family, I think we would make different decisions. Because this would be, do you go to college or do you go to community college in your choices of, or do you go to out-of-state college or in-state college would be the decisions we would be making educationally for our families. You know, first do no harm. Let's not add anything that we don't have to add to more expense.
I find that, oh, gosh.
Well, along those lines, and what ties into so much of what we've talked about today is that there's a lot of subject matter experts in this group and throughout New Hampshire, and people that have to make these decisions are not necessarily always subject matter experts in the decisions they have to make. So moving forward with this group, is there any room for people who really know systems inside out to actually suggest places that can be cut with the same positive outcomes? Or is that too down into the weeds for this group?
That's a really interesting question, because one of the things that's very interesting about this group is its size. Like normally when you design a council committee, whatever, the more people, the harder it is to coordinate. So you generally like to keep the number down to 10, 15 people with 40. The way I've done this with the groups I've started is you have your base committee and then you have your advisory people. And you certainly can bring people in like that to advise us, but you are totally correct. I make decisions every day at the State House and stuff I have no clue about. And I try to put together advisory groups that tell me, well, this is how you should vote on this bill or how you should vote on that bill, because that's how I do it.
Well, also, if we're gonna have an effect on the next budget cycle, we're so late into this one, to your point, it might be great for us to be getting into those weeds over the next 2 years so that we can come prepared with some real suggestions. I just think that there's so much that there are always efficiencies to be found. And if we that are affected by the budget can control how those efficiencies come about, or at least propose and offer, maybe that would be helpful to the process.
I agree totally, because I mean, that's the one thing I've learned in the legislature is things move fast. And if you're not ready, you know, and your process needs to start years in advance, not days, months, or weeks. I thought this was important that we discuss it now. But at the same point, you know, I would have, in retrospect, would have started this process a lot earlier.
And just to add on to that, Kim, I think the thing is, like, we don't know what we don't know, right? And so it was mentioned about what the Policy Institute puts out. And there was one meeting that I asked for us to cancel so we could go to that meeting, right? And so I think the more information that we have about what's happening allows for us to be in those spaces where we learn about some of these things. And I tapped into Phil because they did a presentation. I had Phil come to Nashville, come on cable TV, come on the radio, right? So because we don't know what we don't know what's going on with these processes and their timing either. And I think that the more information that we have, we can influence by giving as subject matter experts, putting information back out, because there are decisions that are made without having full information about, oh, that's gonna have a huge impact if we do this that way. And so I think one of the things that really stuck out was at the Senate budget hearing, there were so many people there that would testify. Anecdotal data, what are we calling that? Anecdotal data, whatever we're using. And I think that made a difference with those changes and those three things that the Senate said, okay, we're not gonna do the 3% cut. But the sooner we can get out with information, with messaging, with the impact is gonna be very important going into the next. I mean, even still now though, we can still make an impact now because it's not over.
It's not.
So it sounds like it sounds, but it's not over yet. It's not over yet, so.
And you know, this is my personal belief, but like, you know, there's key legislators. you get to know them and have casual conversations. I mean, it's amazing how much policy I create next to somebody in a urinal, you know? You know, it's like, hey, while you're standing there was something I wanted to talk to you about, you know. But, you know, I'm joking a little bit, but that is how it's amazing how you do with that with the right person. Like
It's a captive audience, yes.
yes, I mean, I'm just joking about the bathroom, but although it did happen once, but to cultivate those relationships is important because when you testify, you have 3 minutes or less to say what you want to say. It's incredibly stressful. And you're not even sure they're even listening to you, especially the senators are on their cell phones doing whatever, you know.
Except when I call them out.
Right.
They would,
yes.
that's it. Are you listening?
That is so true. And, but no, those casual conversations probably have more value and just getting to know them and, you know, you have a title, you can tell them this is who I am, this is what I do. This is why I'm important. You know, that means a lot to me. And that's not anecdotal. You represent a lot of people
Right.
to me.
Whenever you talk to people who are inside of industries, say the mental health industry, for instance, they can tell you how to come up with efficiencies. They can tell you what works and what doesn't. So if a group like this could respectfully say, we understand you need to cut 2%. Here's the best way to do that without impacting the people who need this the most. I think that might be a nice bridge.
Let me just sort of reinforce what we talked about sort of over the course of what are our actions as a council right now, given where the budget is at this point. And I think in your comment, Dave, about we're not all going to be in the bathroom next to a rep, but
Pretty soon.
but we all have representatives as constituents, and we all have senators as constituents. And if each of us representing our agency or our whoever our core constituency is communicates with our senator or with the Senate right now because it's in the Senate or the Senate senator on Senate finance with specifics, and perhaps if we all said as a member of the SHA-SHIP, spell it out.
Yeah.
We've been reviewing the impacts of budgetary changes on the most vulnerable populations. And and I represent X constituency, X group, and would request that you restore or not cut or whatever the languages you want to use, funding on this item. That could have a collective impact.
So is that a motion? No, I'm just kidding.
Well, I don't know if we can, I don't know, do we have the authority as a group to do it?
I don't know if we've lost our quorum.
I think we have. We've lost our more.
We didn't have any wiggle room on
Okay.
that.
You had mentioned there might be a motion, was that it?
It's something like that, yeah, or
Yeah.
it came too late, yeah, that's.
Well, one of the things we probably need to figure out administratively is, can people in this room vote without going back to their agency? So any motion may take a full cycle between meetings, right?
But it doesn't mean we can't take an action home with us.
Right.
Is there a bill also to change quorum as well?
Yes, so SB 190, well, it's not been signed yet. So, but it passed both chambers fairly easily, and that will allow us to have 1/7 present. So.
In the room physically, is that, yeah.
And that was your bill, Whitney, right? Yeah, you started apprentice, but I always wondered where you came up with the number 1/7 from.
Yeah, I can't even remember because.
Wonderful, thank you.
Yeah.
I was actually shocked it passed because a lot of people were scratching their head over the 1/7 thing. And then, but I thought, you know, we had a lot of backdoor conversations about why it was important. I did it in my caucus and everything. And as soon as we got the ED&A chair on board, she was actually, that made the day. So we got it passed fairly easily, got the amendment killed, which was really a dumb amendment. Yeah. Did I say that publicly? We're still alive, right?
Yeah, we still. We'll make sure you're quoted, no.
My mom said never say dumb. Poorly thought out. So,
Hey, just real quick, a lot of the things that come out of Phil's presentation and that folks said that you could take private action. they are captured on the New Hampshire Alliance for Healthy Aging New Futures webpage. So there are pillars of public health and Medicaid. So just want to say, if you want talking points, newfutures.org.
Thank you.
Will the chat conversations be available in the minutes and the links?
We typically don't put the whole chat conversation, but we do put the links and resources.
Thank you.
This was fun. I think we probably should adjourn given the time. But I'm sorry I totally screwed up today by not allowing the three of you as much time as we had planned, but I really appreciated the discussions and that was important and it'll lead us to next steps.
Yeah.
So thank you, and really thank you for allowing me to share this with some people that I'm totally not worthy of, but I think more than happy to.
It's the reason why we deserve you, because you feel you're not worth it.
And thanks to Kristen and Paul.
Yeah, motion to adjourn.
Yeah, I don't know. Do we need a motion? Yeah, motion to adjourn.
No, it's, you know, quorum, just leave.
Just looking.
Just, you know, start like nobody. Yes.
I'm not gonna go home.
Wait, we gotta do a roll.
Oh, it's the last meeting.